Hey guys, welcome to another edition of EMG's Talkabouts. I'm Damian Navarro, one of the managing partners here at EMG, and I'm actually joined by my business partner, Dr. Blaine Behringer. This is Chapter 3, Academic Medical Centers and the healthcare discussions that we're having around some of the unique challenges and opportunities that we've seen with some of our experience with the healthcare systems that we worked with in the past and currently. Today we're going to talk a little bit about academic medical centers. Now, I don't know if you know this, but 13 of the 14 top-ranked hospitals by U.S. News and World Report are actually academic medical centers, or also known as teaching hospitals. Today, I'd like to talk a little bit more about Blaine's actual experience in not only receiving an education at one of the leading teaching hospitals and academic medical centers, the University of Southern California, but also some of the experience that you've seen working with some clients in that arena. Maybe you can talk a little bit about your background.
Sure. Well, I started out in healthcare doing physical therapy. I got my doctorate at USC and had quite a bit of experience in acute care, doing wound management and treating patients that had undergone trauma. And what I found in a medical care setting is that a lot of times physicians are driving the immediate need of getting patients in the clinics. And those physicians have two folds of needs. They need patients, obviously, to, maintain their level of what they're trying to attain in their clinic. But they also have a need in the educational realm where they may be teaching classes or seminars and trying to get residents or fellows into their practice so that they can further their knowledge and also further the institution's mission of educating physicians or doctors or other clinicians. And so when we approach an academic medical center from a marketing standpoint, we're always looking and trying to structure the marketing and the messaging around those two pillars. One is, how is the consumer going to respond to this messaging? What are we trying to do to get consumers into the clinic? What message do we put out there to accomplish that? And then two, how do we attract residents or fellows? How do we talk about the history of the institution and what they are accomplishing from a research standpoint or from a knowledge standpoint, an educational standpoint. And so just having a fine balance of those two things is very important, and it has to be a part of the plan in terms of developing content, designing a website or some sort of marketing campaign, and it all has to relate. Research is very important to an academic medical center, and having that integrated into your messaging is part of the plan always.
So ideally, what are some of the players that you would like to see if you're starting a brand planning session or a marketing planning session? And typically, the majority of the two messages are coming out of two very different arenas, right? You have the university side, whether it's admissions or physician recruitment or faculty recruitment and HR, and then you have the consumer side, which is patient-centric. Are you seeing those two sides play together? Are you seeing them come to the table earlier on? Maybe what are some of the activities that you're seeing that have maybe changed over the couple of years with as it relates to some of our clients?
So in an academic medical center arena, when we engage with marketing folks, typically we bring to the table a number of players, obviously the marketers, but we also bring clinic administrators, people who are involved with making sure that when we get leads or when a clinic gets leads or prospective patients, they're followed up with correctly. They have materials that are sent out, that they're getting the right responses on the phone and able to schedule appointments. But we also bring the physicians. Usually they're academics, or some of them are doing research. Some of them are actually clinical, and they treat the patients. And we have a very well-rounded group at the table so that we can get a sense of really what the particular service line or clinic is all about, so that when we put together marketing materials, it really truly represents what it is that they're trying to portray and who they really are.
Very cool. So what are some of the major wins or opportunities that you've seen with maybe some of our client stories that have really demonstrated how far they've come in working or collaboratively together to really create a stronger awareness, a stronger program, a stronger mission, a stronger strategy by this collaboration?
Sure. Well, At any institution, any academic medical center, academic institution, research is key. And telling the story of how the research is being translated from what we call the bench or the lab table to bedside is very important, because you don't want to market to a consumer who doesn't understand cells and the minutia of healthcare, versus what they see is curing diseases, helping someone get better or well. And so really telling the story from bench to bedside translates very well to a consumer, and they're able to react to it and understand that a particular institution does research, translational research from bench to bedside, and it really strengthens the overall marketing message and helps get the word out.
Do you think then that there's got to be a reason why 13 of the top 14 hospital systems are actually teaching hospitals or academic medical centers? Do you think that is the connection, that you're actually demonstrating kind of cutting edge research and applying that directly to bedside, and that type of combined message is really, really powerful?
Well, I think that I don't know if the 13 of the 14, the statistic that you're mentioning, is the reason why they're the top. I think probably the top medical centers out there recruit physicians who are faculty members because those people truly want to be at the forefront of medicine. And so when an academic institution recruits a physician who also teaches or is doing research, they want to be at a place that helps them accomplish their mission to find cures, to help people. And so it's probably no surprise that when you recruit that type of talent, you're going to have probably one of the best medical centers. Right. And from a marketing standpoint, it's that type of situation where you have the best and brightest in your pool of talent at your institution. Those are the stories you need to tell. And hopefully you can tie it into some emotional or really interesting story about a patient or a child or something that really tugs at the heartstrings of consumers that are out there, so that they understand not only the educational and academic side of what you're trying to communicate, but the care side and the outcome.
So you got to be really careful to balance it, because if you really just stray too far away from the actual research component, you're kind of losing some of the value proposition.
Exactly. It's not just about the research. It's not just about the facility. It's not just about the outcome. It's about the overall message of those combined to make the 13 of the 14 institutions that you're talking about the best. Right. Because it is that combination that brings out the best in academic institutions.
Very cool. Well, thank you so much for giving a little bit of insight there. For all of you out there, we obviously have a lot of information on our website at www.visitemg.com that you can see a little bit more about some of the case studies maybe, or some of the experience that we have working with academic medical centers. Thanks again, and we'll see you guys again soon.
Thanks.